Hey, deserving listeners, today's episode is about pedophilia OCD, or pedophilia-themed obsessive compulsive disorder. I've received a number of requests to talk about this over the years, and I thought I would talk about it today. So, pedophilia-themed OCD is a subtype of OCD in that the individual suffers from intrusive, unwanted thoughts about being sexually attracted to children, despite having no desire or intent to act on those thoughts. Now, that might sound a little funny if you don't know the difference between pedophilia and pedophilia OCD, because you might be thinking, well, if someone has intrusive thoughts about having sex with children, doesn't that mean they're a pedophile? And it's possible, and sometimes it's hard to determine, but usually it's not very difficult. So let's get into it. My name is Dr. Kirk Honda. I'm a therapist, and I'm also a professor. So to be a little bit more specific, to get into the symptoms here, in a nutshell, and I could talk for a long time about this. I could talk for a long time just about OCD itself. So understand that me talking about this isn't necessarily going to convey a complete understanding of it. It's quite particular and has a lot of nuances to it. But in general, the way that I see obsessive compulsive disorder is that we need to start with the obsessions. Often we focus on the compulsions, right? When you think of OCD, you think about the person who washes their hands all day, or they count tiles on the wall, or they need to, when they enter a room, they have to switch the light on and off 3 times before they feel okay. Because those are the things that are often seen by other people. They're noticeable. They're often the things that really drive a lot of shame for people with OCD. But really, the foundation of OCD is the obsessions. That's where it all begins. So when it comes to OCD, when it comes to pedophilia OCD, the obsessions typically involve intrusive thoughts like, what if I'm secretly a pedophile? Or what if I lose control and reach out and harm a child? Or they might have intrusive visualizations of having sex with children, or intrusive visualizations of nude children or something. And again, you might be thinking to yourself, well, isn't that person just a pedophile? Because quote unquote normal people don't have those intrusive thoughts. I thought that was only for people who suffer from pedophilia. And I'll get into that in a second. I'm going to provide some cases that I hope will delineate. And I'll also say that sometimes it's kind of hard to tell. Sometimes when you actually are on the ground level hearing these stories from people and their experiences, it can look like both or in between, or it's just hard to tell. Because a lot of it actually is dependent on hearing self-report from the individual. You have to have them describe to you their inner experiences, their thoughts, their feelings, their wants, their desires. And not everyone is completely aware of how they feel, especially when you're younger. But also, not everyone wants to admit to themselves or other people what's really going on. So it can. But when I lay out a case that I worked with, I'm pretty sure you're going to understand the difference. But anyway, so just to provide a foundation moving forward, you have these obsessions. The primary obsession the person has, and it's just like constantly going through their head. What if I'm secretly a pedophile? What if I'm a pedophile? Oh my God, is it possible I'm a pedophile? There's that one time when I thought that one boy was cute, and does that mean that I'm sexually attracted? Because I didn't feel sexual attraction, but just noting that the child is cute, does that mean that that I have secret desires to want to? What if I'm a pedophile? What if I'm a pedophile? Now, for some of you, you might actually be able to relate to this. There might have been moments where, as you were developing, you might have wondered, what's going on with me? What if I had this thing? But if you didn't have a propensity to develop OCD, then you probably just had a fleeting thought and moved on with your life and figured, well, I'll figure it out, or probably not, or something like that. Whereas people who have a propensity for OCD, these questions enter their mind and do not go. They stay. and they get stronger and they cause problems and they push out all other thoughts. It's really overwhelming OCD. It's horrible. It is this constant loop that goes on in their mind. The depiction in The Aviator with Leo DiCaprio depicting Howard Hughes is a good example of this. It's just one manifestation of it, but toward the end of the movie, we see that the story of Howard Hughes, his OCD is getting worse and his symptoms are getting worse. And, now it's arguable, is at the end, is it a tic, blah, blah, blah. I'm not going to get into it, but just understand that these thoughts are, if you've never had OCD, if you've never had an obsession before, that was a problem. Let me try to describe it to you. I have anxiety, so I've had experiences where I've had OCD adjacent problems, and I'm trying to think of an example. Well, let's say that you are leaving your house and you think, oh, did I leave the stove on? And you say to yourself, no, I'm 99% sure that I turned off the stove. So I'll just say that to myself and move on with my day. And for other people, though, they will answer the same way. They'll be like, I'm 99% sure, but what about that 1%? And again, for most people that aren't anxiety prone, they'll say, well, yeah, I mean, there's a chance of anything happening, but I'm very, very, I'm almost positive that I turned off the stove. So, I guess a better example would be, let's say that you had driven an hour away from home and you didn't have a way of checking on your stove. For the person not prone to anxiety and OCD, they will say, well, there's like a 1% chance, but there's really no use worrying about it. I guess worst case scenario, something bad happens, but I'm 99% sure that I turned it off, so we're good. Okay, so the person with anxiety tendency and OCD tendency, that 1% will just be a constant thorn in their brain. Just, what about? What if it's going on? And say you're at a picnic with your family or something, and there's just no way to enjoy yourself. You're just constantly holding on to the edge of this cliff. And you might even turn around, go home, go drive all the way home and check and say, okay, it's not, the stove wasn't on. Now, this is differentiated from a scenario where you're an hour away from home and you legitimately wonder, did I turn the stove off? Like there's a 30% chance or a 20% chance. And then you think, it's hard for me to enjoy this picnic if there's a 20% chance that my house is going to blow up because of the gas that's building up in the house. And maybe I should drive home. So that's why OCD is so insidious, because there's some rationality to these thoughts is the point. So the thought, what if I'm a pedophile? That one time I did wonder if I was sexually turned on. I had feelings in my groin when I was at the playground. That's a fact. I know that happened. What if that was an attraction to children? The question might even be, was I sexually turned on? I have a vague memory of having feelings in my groin, but it's possible that I didn't have feelings in my groin at the playground. Maybe I'm mixing up two different experiences in my head. My memory's not so great about everything. But what if I was sexually turned on at the playground that one time? And what if I'm downplaying it? What if I'm in denial of it? And the consequences are so great. Again, it's not completely irrational to have that question in your mind, but that 1% chance becomes a constant thorn in the brain of an OCD individual. So that's where the pedophilia OCD begins, is that obsessive rumination, this constant intrusive thought, this constant emphasis on that 1%, and it just grows and grows and ruins people's lives. They start to do things to account for the anxiety, like never leaving the house or trying to punish themselves whenever they thought about a child, even just casually or something. Okay, so that's the obsessions. And then when we think about compulsions, this is what we see behaviorally, right? So someone with pedophilia OCD will often avoid children, right? They might also review past evidence, quote unquote evidence, like one common pedophilia OCD compulsion thought is, I guess, this might be considered an obsession, but so think about that for a second. But one thought that can enter their mind, or an exploration, maybe that's what I'd say, is that the compulsion is a compulsive exploration that they'll do. So the intrusive thought enters their mind, like, what if I'm a pedophile? What if I'm a pedophile? What if I've already molested? What if I've already sexually abused children in the past? What if? So then they engage in the compulsion of, what if I sexually abused my younger sister when I was younger? I seem to remember there was this time when we were playing this one game, we were playing doctor or something. What if I don't remember all the things that happened? Or what if I don't remember taking it too far one day? I do remember my younger sister going through a period of time where she was kind of depressed later. Maybe it's because I sexually abused her. You get the sense of how this goes, right? Now, again, there are situations where someone has sexually abused their younger sister and they have trouble remembering it and they're finding clues. And once they actually look into it, their younger sister might even say, yeah, you did sexually abuse me. So again, there's some rationality there that hooks the person with pedophilia OCD and keeps them going forward, right? So with the cases that I'm talking about, that I'll talk about in a bit here, when it comes to true pedophilia OCD, and meaning they don't actually suffer from pedophilia, these individuals did not do these things and do not want to do these things, but they don't know that, or they wonder about that 1%. What if, obsess. Okay. So another very common thing for pedophilia OCD sufferers is that they will repeatedly check whether they are aroused or whether they're a pedophile or not. It's the exact same thing when we are talking about the counting of the tiles, or the flipping the light switch on and off, or driving home to check on the stove. People with the gas stove manifestation of OCD will not even be able to sleep through the night because they have to wake up in the middle of the night and check on the stove. They go to bed and they're ruminating 15 minutes, and they got to get up and check on the stove. They go back to bed, they feel okay for a few minutes, and then, but what if I didn't turn it all the way? Or what if the cat bumped it? I got to get up. This is, this is real, and it's unavoidable for people. Unless they get proper treatment, it's almost impossible to battle this on your own. It's not just, just stop thinking about it. It's not like that. So for people with pedophilia OCD, they will do the same thing, but instead of getting up to check the stove, they will enter their mind and their sexuality and their arousal level. They might look at stuff online and then check their groin to see if they are experiencing physical signs of being turned on. But this is complicated because if you're focusing on your groin, and especially if you're touching it, then it's sometimes just that is turning you on physically, right? And you might even inadvertently start to program your mind to associate these checkings, the things you're looking at that you weren't initially attracted to. You might start to associate that with pleasure times, which can cause an autonomic response from your body of arousal when you start to think or see these images, even though you're not actually attracted to children. It's just like a bell with a dog, right? The conditioning thing. And so, but this is a very common thing that I would say almost universally people with pedophilia OCD, and maybe everyone with OCD in general will engage in some compulsive checking. Am I safe? Am I a pedophile? What's going on in my head? Am I at risk of harming people? It's just this constant checking, because that's what anxiety does to us. Under healthy circumstances, when we're afraid of something, that is a cue, a motivation, a compulsion, a drive for us to get to safety, right? If you are walking on a path, you're hiking, and you see a snake, a rattlesnake, that is coiled to strike, you are going to feel fear. And that fear is going to motivate you to get the fuck away from that snake, right? Well, when you are dealing with ongoing anxiety about various different things, that is a drive, a notification, if you will, to the soul, to the personality, to the psyche, that you are in danger and you must take measures to get away from that danger. Well, if you are in constant fear of what if I'm a pedophile? What if I'm a pedophile? That's because, everyone understands in today's society that if you are a pedophile, if you suffer from pedophilia, then a lot of bad things can happen. People might even believe that their life is over, that they should kill themselves, or that they should be in prison, or they should be ostracized, from society, excommunicated from the human race. A lot of people believe that pedophiles should be treated that way, right? So it's akin to a death sentence, maybe worse than a death sentence, And there's a lot at stake, right? There's a big danger there. What if, even if it is just 1%, that is horrible. If I told you that every day for the next, 10 years, there was a 1% chance that each day, you and your children and everyone you loved would spontaneously combust, or that a nuclear bomb would go off in your town and kill you and everyone that you knew. That's horrible, right? And even though you're like, well, 1 in 100 chance it's not going to happen today, that would still be in your mind, right? It's such a huge, horrible thing that even if it's just 1% chance, you're going to think about it, right? So that's what happens. And the people with OCD, it just gets worse and worse and just builds on each other. And over time, the person with OCD, whether it's pedophilia themed or otherwise, they start to become very convinced that these things are true because they live with it so perpetually, So people with pedophilia OCD over time will become quite convinced that they must be a pedophile. Otherwise, why would they be thinking about this all the time? But the problem is they're the ones that are initiating those thoughts. And I'll get into that in a second. Another compulsion for people with OCD, but also pedophilia OCD, is that they will seek reassurances. Like they will go online a lot and ask questions. Am I a pedophile? Am I a pedophile? Am I a pedophile? And although this can be a good thing, this can be a part of treatment, it actually can be perpetuating the problem in that the individual is engaging in that cycle of, is the stove on? The stove might be on. The stove might be on. I need to check the stove. Okay, the stove isn't on. Okay, go back to bed. Is the stove on? So the same is true about pedophilia OCD, is that, am I a pedophile? Am I a pedophile? Am I a pedophile? Okay, I go online. I ask. I tell everyone my symptoms. They reassure me I'm not a pedophile. Okay, I can sleep. And then the itch builds over time. The anxiety builds. The obsession builds. 2 hours later, oh my God, am I a pedophile? Okay, go back online, post, ask. And so it's this cycle. It's not inherently unhealthy because it can lead to education and support and turning things around. But if not treated, if not a part of a larger treatment regimen, which I'll get into later, that's really quite specific to OCD and pedophilia OCD, then this checking behavior is just prolonging the inevitable, or it's just prolonging the problem. It's not that, when I treat people with OCD, I don't say, don't check, because that's not possible. But what we're hoping for is through the treatment over time, they will not feel the need to check. And when their distress is reduced through treatment, and they have the choice as to whether or not to check or not, then they need to not check and do their distress management skills, which I'll get to in a second. Anyway, all right, let's take a break. When we get back, I'll continue talking about it. All right, we're back from the break. So I want to tell you about a client that I worked with. And whenever I talk about clients, I'm always changing details to mask their identity because that's the ethical way. There's also other techniques, but that's what I'm doing here. So I had a client many years ago. He was in his mid-20s, working in tech, as many Seattleites are, single. And he came to work with me on his depression and his anxiety. He wanted to explore his life as a part of working on his depression and anxiety. And so we talked about his current life and his past life and his childhood. He also wanted to talk a bit about his sexual life, some of his traumas in his teen years, what he's ashamed about, and his hopes for a future relationship, not only sexually, but romantically, attachment-wise. There were a lot of worries that he had about always being alone or never meeting the right person. The therapy seemed to be going well, and he seemed to be getting something out of the sessions, but after a number of months, I reassessed his depression, and it seemed as though his depression wasn't better. In fact, it seemed possibly worse than before we started working together. So that was a little bit alarming. It's not completely unusual for that to happen. Sometimes the way to think about it is, well, you can't make an omelet without breaking eggs, and there's going to be some unearthing of difficult thoughts that are going to increase distress in the initial phase of therapy. It's complicated, but the fact that the client was saying that he liked coming, that it seemed to be helping, was somewhat of a relief to that worry that, wait, is this the wrong sort of therapy? Am I missing something? Am I a bad therapist? It's normal to think that. But we explored it and wondered what was going on there. And, I re-upped my efforts to address his depression more directly, that kind of thing. Then one day he came in, sat on my couch, and he told me that he had something to tell me, and it was a big deal. And he said, well, I have been keeping something from you. There's this big thing that I haven't been telling you, and it's probably the reason why I'm here. It's probably the reason why I'm depressed and anxious. And he told me that recently he had realized that he was a pedophile. And he talked about that for a bit, and it was a bit shocking, but, as a therapist, I'm trained to not be scandalized by such thoughts. It's normal as a therapist to hear all sorts of things. So I'm going with the flow and acclimating to this disclosure. It was quite a thing to hear. And he also said he hated himself and he wanted to kill himself. And he had come to me originally, months earlier, as a last-ditch effort to cure his pedophilia. And we, at that point, set out to work on it, to actually directly address his pedophilia. And I went with the assumption that he was a pedophile. And so we set out to manage his urges and reduce the risk of harm to people, which is the standard of care. I had learned that or from him anyway, that he hadn't, according to his report, he hadn't harmed anybody. So that was a good indicator of, or a positive indicator that the sort of therapy we were doing was enough for now anyway. Because if he had said that if there were indicators of greater risk to children, then I would require that he engage in additional services or something else entirely other than just coming to me once a week. But there seemed to be that, I went with believing him at first, particularly because he told me he didn't have to tell me, that sort of thing. And so I never just believe everything a client tells me, especially when it comes to this. I don't disbelieve them actively, but I'm not like assuming that everything. So, there's a bit of a dilemma there, but I, for a time just decided to go with his report and believe him based on a lot of indicators that I was hearing. But anyway, so we decided to continue working for 1 hour a week, and I assessed a number of areas. I, of course, assessed any risk of him harming a child, and that can be quite involved in terms of slippery slope things. If one thing leads to another that leads to harm, you want to be careful about understanding the triggers that can result in a cascade of events that would result, anyway, it's hard to explain. But point is that I assessed risk. I also assessed his current life circumstances, like, if he had access to children, which he did not. He actually actively avoided children. I also assessed his suicide risk and also risk factors involved in both problems, not only in pedophilic urges, but also suicidal urges. Common risk factors are alcohol, rage, other kinds of things. Alcohol being a big one that is a frequent factor in pedophilic behaviors and also in suicide. So, cutting back on alcohol, that kind of stuff. It's okay. So we start working on that, and we're muddling through that in the beginning. And it's a bit up and down. It's a bit uncertain. Of course, I'm seeking consultation, documenting it. But over time, I start hearing things from him that don't really add up. And I took notes on this, so I'm gonna go through the 5 things that didn't really add up to me. Number 1, he said that he didn't have any attraction to children until a few years ago. And after assessing his experience, because I have to go off of his report, right? So I'm wondering, well, was he just in denial of his pedophilia until a few years ago? Was he suppressing it? Is he such a loner that it just didn't manifest itself? Is he tricking me? Is he tricking himself? Those are questions, and it's not unheard of for someone with pedophilic disorder to not consciously be aware of it until they're in their early 20s, but it's unusual. Typically, especially if a client is voluntarily telling me that they have pedophilic feelings as an adult, I would say 100% of the time, they will also tell me that they, whether they were admitting it to themselves or not, they knew they had some feelings when they were younger. It depends on the age of the target, but typically, mid-teen years, there's at least a suspicion, if not a strong awareness of it. So, it was a bit interesting, but not unheard of, right? Doesn't completely rule out pedophilic disorder. Number 2, he was attracted to women his age. Now, for people who have pedophilic urges, they can, at times, absolutely be attracted to people their own age, in addition. But it was interesting because all of his, he had past relationships with women his age. And although these relationships were riddled with issues due to his upbringing, his attachment issues, and just his youth, there was definitely an attraction there, romantic, sexual attraction, the way he talked about it. So, it's a little bit notable. Didn't rule out pedophilia, but just interesting, right? And in the past, he would tell me about these relationships, and again, riddled with issues due to attachment and whatnot. He, at no point when he's like 20 and he has a girlfriend for 6 months, was he experiencing this lack of something, that he was like, oh, there's something missing. If only she looked younger, or there was just nothing there, Now that doesn't rule out pedophilia, but anyway. But the third thing is really the kicker, is that his attraction to children, the way he described it, sounded different than what I had heard from others. It's hard to describe, but typically pedophiles will describe their attraction in the same way that I might describe my attraction to my wife. Like, oh man, when I see her in a tight shirt, this is me talking about my wife. Like, oh man, when I see her in a tight shirt, I just want to get with that stuff. You know what I mean? Or, oh yeah, I remember when we were on our first date and we kissed, it just felt right. It, like we'd known each other for years, that kind of stuff. It's disturbing, but pedophiles will talk about children in that way. If you have never talked to someone with pedophilic disorder, sometimes it's sort of cartoonish the way it's presented, and sometimes that cartoon is the way it actually is. But more often than not, the way that people with pedophilic disorder will talk, if you didn't know the age of the person they were talking about, it would sound completely relatable. They have all the same urges and thoughts and desires and feelings and emotions, and that warm feeling, that the butterflies, the will they, won't they, the longing, the thoughts about the, she's so great. Everything about her is, she's perfect. Not all the time, but for a lot of people with pedophilic disorder, that's the way they talk. And the way that my client was talking about his thoughts in his head, which again, he had never actually directed at an actual human being, the way he talked about it had none of that flavor to it. But again, doesn't rule out pedophilia. He also talked about how he started to notice his attraction, and it just sounded different to me. He told me that when he was browsing porn one day, this again was a few years prior to him coming to me, he came across anime porn that depicted a possible tween, right? In some Japanese cartoon pornography. It's unclear the age of the individual, that the character, but it's clearly coded as, depending on the type, right? But it's clearly coded as a minor, you know what I mean? But it's anyway. So he said that while he was browsing porn, he came across some of this stuff and he was turned on. And after he finished masturbating, he was mortified. And for the first time in his life, in this moment, he wondered if he was a pedophile. And so I really drilled down on this moment, because if it was the very first time, then that says something, right? And I wanted to know if he was aware of his previous attraction, is aware of his previous libido, if you will. I also wanted to know if he had been suppressing things, because if that was the moment, then that is not a typical, if you're typically for someone with pedophilic disorder, this is not the story that you hear. You don't hear like, oh my God, I was masturbating. I came across this thing that may or may not have been a minor, and I was turned on by it, and oh my God, I'm a pedophile. That's just not typically what you hear, So I assessed that. I'm like, well, but at the time, when I first start hearing these things, I'm thinking, well, this just must be a rare case, or he just wasn't aware of his sex. Because again, it's not like outside of this issue, his romantic and sexual life was going extremely well. He had a lot of issues due to his trauma growing up that muddled up the waters when it came to dating and relationships and sexuality and the sex negativity and his own body shame and just all the stuff. It added fuel to the fire, because then he started thinking, well, that's why all those problems were existing. It's because I wasn't actually with children, which is what I'm supposed to, that I was in this. But when he really thought about it, and he would tell me, it's like, no, I loved, there were two significant girlfriends I've had in the past that I was deeply in love with, and I was, absolutely attracted to them. And I still, to this day, look at pornography that involves women that are adults, my age and older. So, anyway, again, doesn't rule out the possibility of also having pedophilic disorder, but it just doesn't sound typical. And so he tells me about this event when he was looking at this porn, and he said that after he finished, he ruminated on this question that had entered his mind all day long for several days, and he couldn't concentrate on work. And this is when it started to dawn on me that this was pedophilia OCD, something that I actually at the time didn't know very much about. I knew about OCD not only as a therapist who specializes in that, among other things, but also as someone myself who has anxiety. If you have anxiety yourself, you get it. If you don't have anxiety, it's hard to get sometimes. Anyway, so I started hearing that a story that felt familiar to me, but just manifested differently, Like for me, although I don't know if I would diagnose myself with OCD in the past, I've definitely had anxiety that is OCD-like. That's the thing is, anyway, I won't go into detail because that'll get me off the rails. But anyway, it just sounded, I was like, oh, I've had that experience, but my experience was around claustrophobia, or my experience was around needles with, at the doctor's office, or my experience was about, did someone roofie me, and I could, and that was like that thought of like, oh my God, what if, and it sounded like that, he finished masturbating and he's just like, oh my God, am I a pedophile? What if I'm a pedophile? Oh my God, am I a pedophile? How do I figure out if I'm a pedophile? What if I was a pedophile? Oh my God. And that rumination, okay? And again, if he had pedophilic disorder, this isn't uncommon, right? That realization and oh my God, oh my God, oh my God, right? That's not completely unheard of. But just the way he talked about it and the intensity of that rumination, the intensity of the intrusive thoughts and how dominating it was. And then I started piecing things together with other anxieties that I had heard about prior to that, right? Either diagnosable symptoms of other kinds of anxiety disorders or full-blown periods of time where he might have been diagnosable, And I start piecing that together of, oh, this pedophilia worry might just be another manifestation of anxiety. And so that brings me to another point about anxiety is that I learned about myself and also clinically that people who suffer from ongoing anxiety, it's like whack-a-mole in that you can cure yourself of one type of anxiety, and over time, the anxiety will emerge somewhere else. Like for me, I've had full-blown panic disorder when I was younger. Once I got that under control, I started having full-blown claustrophobia and like debilitating claustrophobia where I couldn't get in elevators. I couldn't get in the backseat of a car. I couldn't get in an airplane. That doesn't completely ruin one's life, but it does make life difficult. And it certainly provides a lot of shame, right? And inconvenience. And then once I got that under control, not completely, but mostly, then suddenly it's health anxiety that I never had before. And once I got that, it's just a general anxiety problem that will manifest in various different venues. People tend to think of like, oh, well, you have, hypochondria, so that's where your anxiety goes. And for some people, God bless, maybe that's the case. They only have anxiety in that area, but that's not typically the case. Typically, anxiety is the problem, and the way it manifests is just the way that it manifests. Anyway, so the way it sounded like this was him, that he was having whack-a-mole with anxiety, and he had conquered his anxiety or helped to mitigate it over time prior, and then it just popped up in this "Am I a pedophile?" question, Anyway, so he told me that he set out to test himself because he needed to know the answer to the question. He couldn't sleep at night. He couldn't work during the day. He couldn't do anything until he answered the question, am I a pedophile? Am I a pedophile? Am I a pedophile? Am I a pedophile? Oh my God, what if I'm a pedophile? Oh my God. So he told me that after several days of obsessing about this, he set out to test himself to see if he was truly a pedophile. And so he would masturbate and he would force himself to think about tweens. And he would at times become turned on. And to him, this was 100% proof that he must be a pedophile. But he also kind of wondered if he truly was, because there are other experiences that he could point to that indicated he wasn't a pedophile, because he would say, even in this moment, I knew that I didn't really want to have sex with tweens. And I wondered if I was forcing myself to become turned on by this anime porn where it's questionable as to the age of the person. So it was this limbo land, of I'm pretty sure that I am, but wait, maybe I'm not. But oh my God, what if I am? What if I am? Okay. So he had never harmed a child before. He had never actually been attracted to a human being in a situation like this. He had suddenly had this worry as a mid-20s individual. So the checking behavior became something that he would do very often. So this, of course, threw him into a tailspin of anxiety and depression, and that is what eventually led him to therapy, in addition to wanting to kill himself. And he seemed more worried about the attraction than actually being attracted, as I assessed further. As I heard more and more of his lived experience, because, if I just hear him say the topic sentence, he's like, I'm pretty sure I'm a pedophile because I'm attracted to tweens. Well, if you just hear that, you're like, oh, okay. But when I actually drill down and say, how does this actually manifest? How does it actually show up in your life? And I didn't hear the typical things, right? I didn't hear, oh, I was at the mall and I saw a tween and I just found myself wanting to get close to her, or, other things, or, just stuff like that. Or I was online and I was chatting with people, and I came to know that one of the people I was chatting with was a young person, and I had a jolt of energy and of motivation, and I was obsessed with talking to that person. That's what you'll hear. Again, there's various different experiences, but that I wasn't hearing that. What I was hearing was a lot of questions and a lot of anxiety and a lot of beating himself up, and not a lot of foundation of pedophilia. You know what I mean? Okay. The number 4 thing that I observed was that his problem sounded exactly like other cases of OCD, particularly the type of OCD where people worry about jumping off a bridge. So if you have this, if you don't, let me explain. There is a version of OCD where, and there's various different degrees of this. Some people have it to a small degree and they're not diagnosable with OCD, but they're definitely on the spectrum, in that they worry that, so let me tell you a typical, and I had a mild version of this. I probably have had a mild to moderate version of every anxiety disorder in the DSM, but I'll just tell you my own experience. So I'll be walking across a tall bridge, like the Aurora Bridge, if you're familiar, in Seattle. Very, very high. In fact, it's known for suicides. I think I was walking across that bridge, and suddenly I just had this fleeting thought that, popped into my head of, what if I just spontaneously jumped off this bridge? And for people without OCD, or without the tendency to OCD, they'll just have that random thought and think, well, that'd be weird, but that's never going to happen, because why? But for people who are prone to OCD and obsessions and anxiety, this thought will enter and stay and ruminate and intrusivize itself. The individual, and I had a tiny bit of this, where I would have that thought like, oh, what if I just jumped off this bridge? That'd be weird. And then, or another common parallel experience OCD-wise would be, you're driving on the freeway and it's say a 4-lane kind of fast road, and you wonder, what if I just spontaneously turned into traffic? What if I just turned the wheel and slammed into the car coming at me at 50 miles an hour? That'd be weird, right? I don't know, but I'm guessing most people have had some version of that just fleeting thought, right? Your mind kind of wanders. And again, for most people, it just comes and goes, and that's it. But for OCD people, it comes and it stays. Because what if? 1%? What if? Right? And I can kind of relate, because as I'm crossing the bridge and I'm thinking, what if I just jumped off the bridge? I think, well, you never really, there have been times. So this is the thing about OCD and anxiety is so this is the way I think about it, is we start with a feeling that has no thought to it. It's just a feeling. It's just an ongoing buzz, white noise in the background of fear and anxiety. And the self, my conscious mind, is looking to align reality with the feeling. So if I'm walking around with a buzz of anxiety and then I have that normal kind of fleeting thought, what if I jumped off this bridge? Then my brain, my conscious brain and slightly subconscious brain starts to say, well, that must be why you're afraid. And you're afraid, and therefore maybe you are at a greater risk of actually doing that very thing, right? So it starts to feed off of each other, right? The background anxiety starts to grow, the thought grows, the conscious thought grows, and it's off to the races. This is OCD, what I'm describing. So for me, I had this fleeting thought of just like, yeah, what if I jumped off the bridge spontaneously? I've done spontaneous things before that I've regretted. Now, bear in mind that if you're outside of me and me looking at myself in that moment, it's ridiculous. Yeah, I've done spontaneous things, but not like that. I haven't, I've done nothing akin to jumping off a bridge. I'm really trying to fit the data into my feeling, which is I'm in danger. I'm trying to match reality. I'm shoving square pegs into round holes. I'm like, in the past I've done, I spontaneously bought something online without thinking about it fully and then regretted buying that thing. That is very different than jumping off a fucking bridge and killing yourself, right? Or pulling into trap, or turning the wheel and crashing into the car coming straight at you. That turning into oncoming traffic. That's a very, very different thing, and that is not a normal human behavior. People don't do those kinds of things. Have people done it? Yeah, but there are so many stopgaps in our minds and in our behavior that prevent us all from doing spontaneous, sure, we've done spontaneous things. Like, I'm trying to think of another one, like blurted out a stupid ass joke at a party that you regretted later, or, I don't know, kissed someone on a first date that you didn't really feel like kissing. I don't know. I'm just pulling things out of my ass, but people, including myself, I'm not prone to doing, I'm not prone to killing myself. I'm not prone to spontaneous behaviors of death, but that feeling, it just grows. So in the same way, the way he talked about his pedophilia worries sounded exactly like that, where this intrusive thought that would pass through your mind, as it would for a lot of people, I'm guessing, for a lot of people, maybe particularly more and more today because of the awareness of pedophilia, that developing individuals today probably have a lot more of that question. Now, if they're not, that worry, say you're 13, you don't really know what kind of person you are sexually. I would imagine a fair percentage of people have that thought of like, oh, what if I'm a pedophile? Wouldn't that be terrible? Or something like that, And for people that don't have the tendency towards OCD, it just enters their head and they think, well, it's really unlikely. And also there's no use in worrying about it right now because there's no sign of it. And, I guess we'll cross that bridge when we get there, and you just move on. For people prone to anxiety, that thought comes and it stays. And so the way that it sounded to me was that, right? And it matched up with a lot of other things too, because he had reported there had been no thoughts beforehand. He didn't actually want to harm any tweens. He had been having non-pedophilic, relations prior, dating people his own age and stuff. And so it sounded that way, of just like this thought just enters your mind. Wait, what if I spontaneously jumped off this bridge? What if other things are like, this is another one. What if I spontaneously pick up a pencil at work and stab it in the eye of a coworker? What if, I've done spontaneous things before that I've regretted. What if I did that? That would be horrible. And then the problem is for these individuals, the real insidious, horrible nature of this disorder is that the intrusive thoughts happen over and over and over again. The person is terrified. They don't want to do these things. They engage in the checking, right? And the only way to check often is to tempt yourself with it or to play it out in your head, right? And then the conclusion often is, well, I must want to. What kind of normal person throughout the day thinks about stabbing a coworker in the eye with a pencil unless they want to do it? What kind of person constantly wonders about whether or not they're a pedophile unless they're a pedophile? What kind of non-pedophile forces themselves to think about young children when they're masturbating as a way to check if they're a pedophile? That's pedophilia. You must be a pedophile. It's not normal, okay? If I am having intrusive thoughts of jumping off this bridge to the point where I can't even get near a bridge, well, then I must be suicidal, right? That's the only conclusion. And the thing is the answer is no. You're not suicidal. You're not a pedophile. You're not violent. You don't want to stab anyone with a pencil. The intrusive thoughts are just intrusive thoughts. That's all that it is. And anyway. So, but as I said earlier, it's kind of weird because you can have someone who legitimately suffers from pedophilic disorder and has empathy and is terrified of being a pedophile and does not want to harm children and has quote unquote intrusive thoughts of attraction to children, and they're busted up about it and they're confused. So it can sound similar. And I want to point that out because a lot of the conversation about pedophilia OCD is that it's very easy to detect the difference between the two. And sometimes it can be. But when it comes to psychology and human behavior and personality, there's a fair amount of uncertainty. And when I have worked with this sort of thing, there's a part of me that wonders, well, it's possible this person does have some pedophilic urges in addition to being attracted to people their own age. And we'll never know really until things play out, or it's hard to know because of all the culture and the suppression around these. It's hard to know what's in their true groin, if you will. So it's not cut and dry, but there are some quintessential hallmarks of pedophilia OCD as opposed to pedophilic disorder, which I've been over anyway. So the fifth thing that I observed was that he had a history of various forms of anxiety, which I've already been over. So to review, he said he had no attraction to children until a few years ago, in that inciting incident. Number two, he had a normal life being attracted to women his age up until that point, and continued to be attracted to women his age. Number three, his attraction to children sounded very different from the others I had heard in that, it had all the classic sign of pedophilia OCD. And his process sounded exactly like other forms of OCD, like the jumping off the bridge thing. And he had a history of anxiety. So let's take a break. When we get back, I'll tell you what I did. All right, we're back from the break. So once I started to detect or wonder, hypothesize that it wasn't pedophilic disorder, but was in fact pedophilia OCD, over time I would assess him on this. And I, fairly early in the process, introduced the possibility to him. And at first he was not convinced, and I wasn't trying to convince him because I didn't know at first. But over time, he eventually started to see it that way. The data matched the description of pedophilia OCD, and we collaboratively conceptualized it truly as pedophilia OCD, not as actual pedophilia. And although this was a relief to him, it didn't end the problem. This is just the first step. And treating OCD in general and treating pedophilia OCD is not a walk in the park. So just knowing, and this is another problem that I see online, is that there will be people that will know or highly suspect or be fairly aware that they have pedophilia OCD, but the suffering hasn't ended. They are still ruminating, they're still terrified, they're still suffering. So it's better for them to be aware of it than not, but it's definitely not the end of the road. It's barely the beginning of the road. So I say all that because if you know anyone who has this issue or any sort of OCD, treatment is the answer. And when it comes to the confidence level that I can tell you based on research and my own experience that therapy can help people with something, OCD is one of those things I can be very confident that if you have a competent therapist that knows what they're doing and you have a client that sticks it out, there's a pretty good chance of a positive outcome, of drastic reduction in symptoms, if not complete eradication. So I say all that because there's a lot of issues that I talk about on this podcast, a lot of issues that therapists face that I can't say that about. I can't say that about disorganized attachment. If you have disorganized attachment, if you have a personality disorder, then it can be slow going. And with tons of therapy, with exactly the right therapist and a client that is highly motivated and putting in all the work, you might go to therapy for 15 years and get like 50% down the road. There might not be enough years in one's life to actually get more than 70% down the road with some of these issues. And that last 30% can be pretty bad, you know? So there are things, now that doesn't mean it's worthless to pursue those efforts, but when it comes to things like PTSD or OCD, these things, evidence shows and my own personal experience shows that with proper treatment, if you stick it out and you actually do the steps and you do the in-between session work, you can have a drastic reduction in symptoms, and it can be such a relief. The problem is that with anxious people, they worry so much about this sort of thing that they don't want to face it and they don't want to go to therapy for it. And they especially don't want to do the exposure necessary. And that's why you need a good therapist to kind of guide. But anyway, so the treatment for this client involved the following. Number one, and this all kind of coincide. There was no really steps to this, but this is all just happening basically all at once. But the first thing was educating him about OCD and pedophilia OCD because he had never heard of it before. So he didn't really even understand OCD, as most people don't, as evidenced by a lot of people saying, "Oh my God, I like it when my pencils are all lined up in the same orientation. I'm so OCD." It's like, you're not fucking OCD. You're just clean or particular, or you like to be organized. Shut the fuck up. You don't have OCD. You might have OCD, but that's not OCD. Anyway, so I set out to educate him about OCD and pedophilia OCD because it's important that, as with any anxiety disorder, the client needs to be the primary, I don't know if I want to say therapist, but the client needs to understand it as well as I do. There are things that I treat people about, that they don't necessarily need to understand everything that I do. But when it comes to anxiety, not only do they need to understand it so that they can, in between session, help themselves, but also just understanding it alone can do a lot. For me, I had full-blown panic disorder in my early 20s. And when I became a therapist, which was partially motivated by an effort to seek answers about that, when I took psychopathology, which I think would have been in my first quarter, and we came upon, I actually had Ned Farley, for those familiar. He's a friend and colleague of mine, but he was my psychopathology class instructor, and he talked about anxiety, and then he lectured about panic disorder. And when I heard that, because I'd never heard it before, this is before the internet, and so or it would be basically before, 1995, and I instantly recognized, oh my God, that's me, especially the symptom of the sufferer will feel like this unnamed sense of doom that they can't really describe, but they definitely feel it. And that was exactly what it was like for me. There was this doom, but there was no rational explanation. But I just knew that I was in danger and that I was doomed and that something was chasing me, but not really. It's a panic disorder is horrible. And I want to be also clear while I'm on this soapbox that you can have an anxiety attack, but that isn't necessarily a panic attack. Panic attacks are particular. In all likelihood, even if you're an anxious person, you've never had a full-blown panic attack. Sometimes it's described as like, physiological response, like pounding heart, that kind of thing. And yeah, but the panic attacks that I had were almost like hallucinatory experiences. It's hard to describe actually, but it's horrible. It's like nothing. I've had anxiety my whole life. I've had anxiety attacks. I've had huge anxiety spikes. I've had anxiety to the point where I've fainted, where I pass out because I'm so afraid. And yet those are not panic attacks. I say that because although it's horrible to have that amount of anxiety, I would rather have the biggest anxiety attack I've ever had than to have a minor panic attack. Anyway, so how did I get on that topic? Anyway, so education is important. And so as soon as I learned about panic disorder, 90% of my panic disorder was cured, just knowing it. That's not true for everyone, but I can go into detail as to why just knowing about panic disorder helped me, but moving forward. So I educated him about anxiety in general, OCD, and also pedophilia OCD. I also recommended that, and he kind of did this naturally of finding online support forums, like on Reddit and stuff that will help. Now, this is a mixed bag because, the checking thing, but it can also it could be extremely reassuring to learn about other pedophilia OCD sufferers, to learn that you're not alone, to learn that it's a completely normal derivation of human psychology to have this happen to you, to know that there's a cure, or that, there's a way out of it, the way a lot of people will describe. Anyway, so that's the other thing. And then the third component, of course, is just treatment, right? Psychotherapy. And the way that I treated him was the way that I treated all people with OCD. That's the thing about pedophilia OCD. I feel like sometimes people think of it as this different thing, but it's not. Pedophilia OCD is just OCD, but it just happens to be focused on pedophilia. You can have OCD focused on whether or not God hates you or not, and you pray all day long. You can have OCD related to cleaning your hands, or counting tiles, or turning the light switch on and off, or checking the stove, or checking on your kids to make sure that they're still breathing at night, or checking your stock market account, or checking the air quality in your house, or whatever. Those are just off the top of my head, and also checking to see if you're a pedophile. It's exactly the same. It manifests exactly the same, and the treatment's the same. So I start always with emotional awareness and monitoring one's distress, because as we head into exposure, as with trauma therapy, if you've heard me talk about trauma therapy, it's the exact same thing. I need the client to quickly, in the moment, be able to accurately, at least most of the time, assess and tell me their distress level, because as we head into exposure, there should be some distress, but not too much. And if I can't count on them monitoring their distress, then we cannot move forward. Plus, they need to understand their distress level, because in between session, they have to be doing a lot of emotional regulation and distress management, not only just to be less distressed, but also as a part of their habituation, rewiring their brain, literally. So that's the first thing. And for him, he was fairly self-aware enough such that it didn't take long for me to be confident that he could monitor his distress in the moment. Another component to this monitoring is not that they have the ability to monitor only, but that they actually remember to monitor their distress. That's another thing. So I could have a client who is very good and demonstrates in the moment, in session, they can seemingly evaluate their distress level in that moment. But in between sessions, I find, when I check in with them, when they, at the beginning of the next session, I ask, tell me about your general distress level curve over time, the sine wave, or, the graph in your mind as to the ups and downs of your distress level since I last saw you. And if I had a client that said like, oh yeah, there was really only one day that I even asked myself about that question, and I was like a 4 that day or something, then, and this is after I've told them, I need you to be in a habit of checking in with that. And at least for now, make it a routine. You can either put an alarm on your watch or your phone, or a Post-it note, or just a mental note, whatever works. But and if they can't do that, then that's anyway. So that's that phase. The next phase is the ability to regulate those emotions, particularly distress, and that could take a long time. The ability to prove to me that they can indeed reduce their distress, and that can take a long time. For him, it didn't take that long. And then the third component is to challenge their irrational cognitions, their automatic thoughts. Like the thought that he might have would be, if I have a thought about a naked child, an intrusive thought that just pops into my head, then that must mean that I'm a pedophile, and or it raises the question as to whether or not I'm a pedophile, and therefore I have to check to see if I'm actually a pedophile. And so that is an irrational thought. Once I assessed that he wasn't suffering from pedophilic disorder, it's irrational to have a random thought enter his head, particularly if he's been forcing himself to think about it. So it's just going to pop into his head because it's just a part of his, his daily routine. I don't know if you can hear my dogs barking. And you have this random thought that pops into your head. It means nothing. It's just a random thought that popped in your head. Like when someone is crossing a bridge and they think, what if I jumped off this bridge? Or if you are at a picnic and you think, what if my stove is on? These are, or you're, if for me, I just had Dukes of Hazzard pop into my head, the TV show that I watched when I was a kid that has a problematic car. I just had that thought. What's the meaning of a thought? There is no meaning. It doesn't matter. Our brains think of random shit all the time. So it doesn't mean anything. It's the fact that Dukes of Hazzard just popped in my head, Bo and Luke and the General Lee of godforsaken car. What does that mean? Does that mean I'm a Confederate? Does that mean I need to watch the show? Does that mean aliens are trying? It doesn't. It just means that our brains are fucking weird. So you had a random thought of a naked child. It doesn't mean it, especially now that we've established that you're not a pedophile. It's just a random thought, and you just have to drill it into your head that your brain thinks random shit. At the very least, in the first phases of therapy, I really try to convince, and this is where charisma as a therapist comes in, and your relationship with them, how attached and close you feel and how much they trust me. But I, at the very least, want to get them to a place. It's going to be very hard to convince them of this, really. Even though they're on board with it, they're like, yeah, I'm pretty, but their body has a hard time going along. But if I can get them to just raise the question, they have an intrusive thought of a naked child, boom, in their head, or of lolly porn or something, and just an intrusive thought, or an intrusive, anyway, so they have that. And they're convinced this is like, oh my God, I might be a pedophile, I better check. If I can just have, at the very least, a question mark there of maybe this means nothing, then sometimes that's a huge success. So I'm not always trying to shoot for the moon. It's like sometimes there's a gradual process there. So that's another part of that. Then we actually want to, at the same time as doing all this stuff, we want to gradually reduce the compulsive activities. Like, I was talking earlier about the checking activities that are very common. And so in this phase, it's hard to describe, but So in this phase, for example, with this client, he would have the intrusive thought, or he would be masturbating and a thought would enter his head. And the way that it worked for him anyway, and this is true for a lot of people with OCD, regardless of what it's manifesting on, that the thought enters his head, and instead of fighting it, he just allows it to enter his mind. He doesn't entertain it, right? He doesn't lean into it, but he also doesn't fight it, and he doesn't get alarmed by it. That's always the thing, is to just reassure himself it's normal for the brain to wander, and it doesn't mean anything. It doesn't mean anything. It doesn't mean anything. It's just, yeah. Same with body anxiety, right? Like, oh my God, I have a pain in my chest. Well, if you've already done all the tests, then in all likelihood, that little sensation in your heart region doesn't mean anything. It doesn't mean anything. It doesn't mean anything. It's happening. And I'm also, this is all mindfulness stuff. I'm also noticing that I'm worried that I'm having a heart attack. But that's just a random thought in my head, and that's okay. I'm not going to fight it. I'm not going to beat myself up for it. I'm not going to entertain it. I'm not going to ruminate on it. There's this higher mind that I'm telling myself that I've established in my soul after thinking about it and talking about it with my therapist. I've established this central figure of who I am that pushes back on stuff. Like, this is my prefrontal cortex pushing back on my amygdala saying, nope, I hear you. You're there, and I'm with you. You're having that thought, and it's just a thought. There's no danger. I don't have to do anything. I don't have to avoid it. I don't have to fight it. I don't have to check it. It's just a random thought. This is key to OCD. So, that whole process is also a part of the, from the outside, it will be less checking, right? With germs, for example. Oh, I touched that handle. What if? Okay, so you can't get rid of the thought because that's just going to happen. But you can participate in a different cognitive conscious process, right? Okay, I'm noticing right now that I'm having anxiety about touching that door handle at work. Okay, yeah, and sure, there is a possibility that I have germs on my hands right now, but it's unlikely because I used hand sanitizer. And even if there is some kind of thing on my hands, 99% of the time it's a cold or the flu or COVID or something, and most of the time people recover. Now with COVID, it's kind of funny, but it doesn't help people. But you know what I'm saying. So for him, it was, oh my God, am I a pedophile? What if I'm a pedophile? And instead of forcing himself to look at lolly porn or forcing himself to think about, to see if he would get aroused, he refrains. He just doesn't. And as a part of this, for him, this wasn't a problem, but for others, they would refrain from going on Reddit and asking, am I a pedophile? I have pedophilia OCD, right? I have pedophilia OCD, right? I have pedophilia. Let me tell you my story. I have pedophilia OCD. Again, I'm not shaming people for doing that at all. It's not the end of the world that if people are engaging in that. It's certainly not causing the problem. And sometimes it is the best you can do until you get treatment to get that reassurance. But it is not, if someone's in treatment and they are getting better, this is one of the behaviors that needs to be extinguished, because it is essentially training the individual to do these kinds of things. Because there's this mounting. So here's the way that I think all the experts think about it, including myself. So you have this the way that it's all cyclical. So you have this mounting itch, regardless of how the OCD is manifesting, right? And you have this increasing compulsion and this obsession and this worry and this distress and this terror, and it's like it's building. And typically, left alone to their own devices, people will engage in checking. I must count all the tiles. I must check my stove. I must focus on naked children to see if I get aroused. I must drive home to check the thing. I must wash my hands. And in doing so, it relieves them temporarily. It actually will reduce their stress, and it trains them to engage in the compulsion. Because the behavior is, the brain starts by tricking itself to be afraid of something, and then the brain tricks itself to thinking that the thing that you did actually solved the problem. It didn't solve anything. It's just this one big trick that the brain is playing on itself. And so the way to cure yourself of this is that as you have that mounting itch, which you can't get rid of, especially in the beginning, and again, this is all monitored by a therapist and knows what they're doing, because it has to go at a gradual process, typically, and there's a lot of ways of interpreting the irrational thoughts. But anyway, the individual has mounting worry, and they engage in that monitoring of their distress and their distress management such that they stick with that feeling and they mitigate it significantly by their relaxation techniques. And incidentally, it's best if they can work with everyone around them, that they just tell people. You wouldn't necessarily have to tell people around you that you suffer from pedophilia OCD. You could just say you have OCD and you don't want to get into exactly what it is that you're worried about, but I need accommodations at work to occasionally go to the break room and just sit in quiet, or I need to go to my car every 5 minutes, for 10 minutes or something. Is that okay with you, boss? Or you talk to your spouse or whatever. This is because sometimes the shame of it all can seriously hinder treatment, So anyway, so the individual has this mounting itch, and depending on where they are in treatment, if they can handle it, then they handle it without checking. There's this urge to check. There's this urge to do the compulsion, to count the tiles, to turn the light switch on and off, to do the pedophilia OCD checking. And you refrain from it. And so what your body eventually habituates to is the intrusive thoughts. That question of, and if you've never had OCD, it might be hard to understand this, but the question carries so much terror. Am I a pedophile? Am I a pedophile? What if I'm a pedophile? What if I'm a pedophile? For everyone else, it's just like, well, I don't think I am, and I guess I'll cross that bridge when I get there. But I'm pretty sure I'm not. In fact, I know I'm not, or whatever. For people with OCD, it just builds and builds and builds. And so the trick is that the first time the question was asked in the person's mind, the first time they were crossing a bridge and they thought, what if I jumped off? The very first time there was a little bit of anxiety. The second time it doubled. And the third time it doubled again. And the fourth time it doubled again. It just gets worse and worse and worse. And so you want to roll back that clock. So you have to, as you have those thoughts, instead of engaging in the compulsion, you relax and you tell yourself you're not in danger. Everything's fine. You're not a pedophile. Or another solution as an interim cognition would be, well, maybe I'm a pedophile, but I'm not at risk of harming anyone. Worst case scenario, I am a pedophile, but I'll be damned if I'm ever going to harm a child because I have empathy. So, if I'm a pedophile or not, that wouldn't be great. But the real problem is harming children, because that's typically what people with pedophilia OCD have. They also have the worry of being ostracized by society, that sort of thing. But the treatment involves having that itch, doing their regulation exercises, engaging in their support system as best they can, right? And over time, the clock is rolled back and the body no longer has that associated feeling when they have that question or when they have that intrusive thought. They roll it back to the very first time they ever had that, which is minoring, just a minor little fear. Oh, what if I jumped off this bridge? Oh yeah, that would be bad. Instead of, I can't even leave the house because what if I find myself on a bridge, or what if I spontaneously drive to a bridge and jump off it, or what if I do something akin to that, then it always blossoms. Okay, so I hope I'm explaining it. And if you were with me right now, dear listener, I would ask you, does this make sense to you? I'm guessing it does because you're smart. Anyway, so for him, it involved the reduction of the compulsive activities was not actively looking at lolly porn to see if he would get turned on. Also, not leaving the house. Also, not attending get-togethers where children might be, family get-togethers. Also, not imagining nude children to check to see if he would get an erection. And it's important to point out that this phase, for anyone with OCD, is not easy. It might sound easy. Yeah, just don't do that. No, this is really hard work, and it takes a long time. And there are ups and downs. And there were times when he would come in and he would backslide, and that would last for a month or two. It's hard. It is so hard to push against the monster of OCD that is in your mind. It is so hard. So the other major element here is exposure, which I've already been over because I was kind of infusing that whole thing. But to be specific, one of the things we did is we wanted him to be able to be around children without freaking out. And so it needed to be gradual, though. And upon assessing him, I found that it would be overwhelmingly terrifying for him to actually be around physical children in the real world. So at first, I found that for him, it was a gradual exposure to actually just watch a TV show with children that might be on it, like Modern Family or something. And because that was enough of an exposure of, I'm watching a TV show that has a minor. What if I get attracted, or what if this triggers something and I run out the door and I rape some child? This is what it's like. And so watching this TV show and doing the relaxation exercises, we found to be an interim step of exposure. And then once he was relaxed with that and his body, his neurology habituates to that without freaking out, then we start actually going into the real world. He did this in between session and could, not necessarily, go to an elementary school or a middle school or something, but walk around at a art fair or something, a street fair where kids are likely to be amongst adults as well. And just walking around and doing his relaxation, intrusive thought. Oh, there's a kid. What if I look at the kid and I end up being attracted to something? And what if, okay, those are just thoughts. They don't help. They're not rational. Worst case scenario, you notice something, we'll talk about it. There's nothing to be afraid of. There's no panic. I'm with you. Do your relaxation, your self-talk. Everything's okay. Okay. And then the key, though, to exposure is that it has to be prolonged. You have to do it. You can't just do it for a few minutes because that overloads the system and can even reinforce the neurology of the terror. So you have to stick with it. The analogy is that when you get a cat and you have a litter box, and let's say that the litter box smells funky, as they do sometimes. Well, if you live in the house long enough and you stay home long enough, you will no longer smell the litter box because your neurology will literally rewire itself such that it's not going to signal to you because it's so normal, right? Our brains are oriented mainly towards novel things. So if something is extremely normal, then at the very least, we'd have to concentrate to really notice it, So that is neurological habituation that we very much understand. We've known about this for decades. The same goes for trauma recovery or with any sort of compulsive problem, even like substance abuse, but particularly things like OCD. So your body has to habituate to the trigger, and your body has to learn that it's just a normal background thing that happened. It's not a big deal. To the point where what can happen typically, and what happened with him was that through habituation, the intrusive thoughts went away. So at first I'm convincing him, allow the intrusive thought to happen and convince yourself that the intrusive thought means nothing. It's just an intrusive thought. Over time, it's not the expectation that the intrusive thought is going to be forever. You know what I mean? But it might be, for some people, it's hard. There are certain weird, like I have this one memory that it pops into my head that is of being in Chelan, which is like central Washington. It's a lake, and it's, at least for people in Seattle, it's kind of like a resort town-ish. And I have this one memory that pops into my head, and it's popping into my head right now, of sitting in this club, this like bar, tavern, club place. And it might not have even been Chelan. It might have even been like Wapato Point. Anyway, and I'm with my friends, and it's dark, and there's a band playing, and I'm sitting at a table, and I have like a whiskey Coke with some ice and a straw, and my friends are sitting. And I don't even know if I have the memory right, but I've noticed that I have this memory pop into my head, and there's nothing significant about the moment. And I've looked at it forwards and backwards. There is nothing notable about this memory. I'm pretty sure what happened was I just had a random memory pop into my head like a month after it actually happened. This was like 15 or 25 years ago. And at the moment I thought, well, that's kind of funny. Why is that image popping into my head? Well, it probably just randomly did, because that's what happens soon after events like that. But because I noted it, and I thought, that was kind of funny, then it kind of locks it in, and it raises the chance that another month in the future, I'll have it popped in my head again. And now it's become like this recurring popping into my head memory, but it means nothing, right? And it's not frightening to me because it's just a stupid little scene. So that's true about a lot of things, right? So if, and it's especially true for people with OCD. Intrusive thoughts are the hallmark of the problem. That's the whole genesis of the whole problem. There's even some science that suggests that these individuals just have, brain chemistry or neurology circumstances that result in more of these kinds of intrusive thoughts, particularly around danger, around things that we're afraid of. Anyway, so that was the exposure, and then about 6-12 months into it, his symptoms were basically gone. He still had some minor intrusive thoughts, but he was totally okay with it. And after that, we were both very convinced he wasn't a pedophile because once he had recovered from it and was no longer in the throes of the intrusive thoughts and the checking and the obsession, then he was back to his normal self. And he was like, yeah, I don't know what was going on with me. That's the thing about these anxieties. It's like afterwards you look back, you're like, geez, what was going on with me? And that's the sweet spot, because that means you've been through treatment, and that means that you've recovered. You don't want to have shame about it because it's normal, but that's what you look back on. That's the way I look back on it. It's like, what was going on with me with that claustrophobia thing? that was rough, but my goodness, my brain is funny. Now, I'll also point out that in all likelihood, post-treatment with him, he probably had recurring symptoms emerge around pedophilia OCD. It wouldn't be uncommon. That's the whack-a-mole nature of anxiety and OCD, is that you can go through recovery very well and in a very firm and sure manner, and yet it'll just come back. And sometimes it's related to stress in your life, and sometimes it's not. Sometimes it just starts happening again. So in all likelihood, his pedophilia OCD treatment required maintenance. I never heard from him again, but it wouldn't be unusual if that were the case. All right, let's take a break. All right, we're back from the break. So to talk a little bit about etiology or cause of pedophilia OCD, what I'll say is that the science is not great, as we don't have the ability, our resolution of measuring the brain and of personality is pretty bad and at this point. So we don't really know why anything in the DSM happens, but it seems like it's a combination of genetics and environment, which isn't really saying much. To me, the way I see it is that in all likelihood, people are born with a tendency towards anxiety in general and OCD maybe specifically, and they experiences growing up that exacerbate it, make it either severe or minor to the point of not really even showing itself. And so there's that. Also, you can have experiences throughout your life that can cause it. There's also epigenetic factors. But anyway, so that's what I'll say about that. I also wanted to read some accounts from Reddit, actually. I forget where this was pulled from in terms of the exact subreddit, but it's a public post made by someone publicly, so I figure it's okay to read this without identifying who they were. I wouldn't even know who they were anyway because it's an anonymous handle. But anyway, I read through a lot of accounts and found the following account to be a pretty good representation of pedophilia OCD. So I'm just going to read their post here. I've always had a history of social anxiety and depression. All right, so just chiming in here. I'll chime in occasionally. So right there, you have that hallmark of pedophilia OCD sufferers, and that the individual has always suffered from anxiety and depression. They go on to say, I've had health anxiety. I often obsessively fear that a small headache is a brain aneurysm or every pain in my chest is a heart attack. That's the closest thing to OCD that I've had in the past. Over the past 6 months or so, I've gradually developed a deeper and deeper fear that I'm inappropriately going to be attracted to little girls. Every time I see a young girl that's cute, I get intense anxiety that some kind of sexual attraction is forming, and I obsess over proving to myself that these feelings are not sexual. For a while, it led me into avoiding all public places, but I've recovered a bit. All right, so just chiming in. Let's review this. Okay, suddenly, we don't have the age of the person, but I'm assuming somewhere in adulthood, right? And they're saying, over the last 6 months, I've gradually developed a deeper and deeper fear that I'm inappropriately going to be attracted to little girls. So you just think about the wording of that I'm going to be attracted to little girls. I'm worried that I'm not attracted to little girls, but I'm worried that I'm going to be. This is the hallmark of pedophilia OCD. Every time I see a young girl that's cute, I get intense anxiety that some kind of sexual attraction is forming, and I obsess over proving to myself that these feelings are not sexual. So just chiming in here, this is something that I haven't talked about yet, but I should talk about, which is that if you have a young man who is not a pedophile, and he sees a 7-year-old girl at the mall or something in public, and he turns to his friend and says, "Oh my God, that little girl is so cute." I guarantee you, onlookers, or even the friend, or even the person themselves, will have a huge question mark as to whether or not that person is a pedophile. Now, might that person be a pedophile? Sure. But acknowledging the cuteness of a young child is inherent to human beings, or the noticing of the cuteness. We are wired to consider children to be cute. That's why we like cartoon characters like Mickey Mouse and Hello Kitty that have big eyes and big heads, because we clearly evolved an attraction, if you will, not sexual, but an attraction, a preference, a pull, a gravitational pull towards babies, because that made the tribe take care of babies, right? Noticed babies because they need a lot of care and a lot of attention. And so, it's completely human to recognize, to say, oh, oh my God, that kid is a cute little kid. But you have a young man, I think particularly today, that has that thought. And I think I don't know, but this is just my anecdotal experience, but I think pedophilia OCD is on the rise and has been over the past 20 years because of this problem. That when I was young, there was some paranoia around this, but it's way worse now. So when we hear this person's words here, every time I see a young girl that's cute, I get this intense anxiety that some sort of sexual attraction is forming. And, we have a really silly, childish idea of sexuality, particularly when it comes to this sort of thing, that if you were to consider a 7-year-old girl in public to be cute, the fact that anyone wonders if that's a sexual attraction is evidence of how fucked up we are as a society. Is it possible that the person that considers a 7-year-old cute is it possible that this is a pedophilic urge or noticing? Yeah, I guess anything's, but it's also possible that they want to kill the child and drink their blood. Lots of things are possible, but why is your brain going there? And why do you think that's always the case? Why is this a question that emerges? And I'll tell you, I have a personal beef about this because as a man, particularly as a young man, there's a time before I was a therapist, I used to work with youth, and I would take them into the community. I was basically kind of a complicated therapeutic babysitter of a sort. And I would get looks. Back then I had long hair and, I don't know if I looked like a grunge dirtbag or something, but, and I don't know what the people were looking at. Maybe I was biased. Maybe I was looking for shit. I don't know. But it felt like people were having major questions. What is that man doing with that child? What's going on there? And the first 100 times it happened, I'm like, what are you going to do? But over time, you just get tired. In the same way that as a Japanese American, the first 100 times someone asks me where I'm from, I'm like, yeah, I guess they think that all Asian people aren't born here. But okay. So I just answered the question. But after 1,000 times, it just fucking gets on your nerves. And so this is a thing, and it has to fucking change. And this societal idea is a major driver of pedophilia OCD, in my opinion. I can't know that, but anyway. So this person says, every time I see a young girl that's cute, I get this intense anxiety that some kind of sexual attraction is forming. Even though it's not, but I'm like, what if it is? And I obsess over proving to myself that those feelings are not sexual. So that's that OCD cycle, the obsession to the compulsion to the obsession to the compulsion, the rising of the anxiety, the checking, the rise, the anxiety is soothed a little bit, the rising anxiety, the checking, the anxiety goes down. It's just this constant sine wave going on. Long term, I'm afraid of my friends and family having daughters long term. So in the long term, I'm afraid that my friends and family will have daughters. My fear is that I'll be left to babysit them and that I'll do something awful to the child. I'm also afraid that if I'm not able to have relationships with women my own age, that I'll resort to pedophilia. Okay, so just chiming in here. Now, it's possible the person is a pedophile. We can't tell from a Reddit post. It's possible that the person is actually attracted to children, maybe has already harmed children and is in denial of it or tricking themselves, and they're just wording it like it's this intrusive thought that has nothing to do with them when it has everything to do with them. But the way this is described, I just want to say that up front. I have no idea about this individual, but the way it's described is exactly pedophilia OCD. You notice there's nothing in here of, I am attracted to little girls. But there's an intense, intrusive worry. What if I am? And all those what ifs, right? This individual's like, oh my God, what if my friend has children and has a daughter? Oh my God, what if that happens? You're just like, Jesus Christ. I mean, even if you were a pedophile, like that's the hallmark of anxiety and OCD, particularly is that future tripping catastrophization. And they say, my fear is that I'll be left to babysit them. Okay, so just, and this is my work with people. So, you break down each step of the way. It's like, okay, let's break it down. So you're worried that your friend will have a daughter. And sometimes I'll even have the client identify, because if you just, the breeding ground of anxiety and OCD is non-specific circumstances. What if there's a daughter and I babysit and I attack the child? Okay, so let's get specific. And what happens with people with anxiety and OCD is they don't want to get specific because they're terrified of what they'll find. But if we actually look at it closely and really focus on it, the ridiculousness of it is more apparent. Because if you talk generally, it's like the way Republicans and Democrats talk about each other. It's like, well, they, you know what I mean? And you can say anything about them, but when you get specific, then it breaks down. So when it comes to this, it's the same. So I would say, name a friend that is likely to get married and have kids or something. Okay, my friend John. Okay, your friend John. Let's say your friend John gets married in the future, but how many years in the future are we talking? Oh, I don't know. That's reasonably like 5 years. Okay. So in 5 years, he has a daughter. All right. And 5 years later, the daughter is 5 years old. So this is 10 years in the future. And at that point, your friend John asks you to babysit your daughter. How likely is that to happen? Well, not very likely, because I'm not really maternal and I've never babysat before. Okay, so pretty, but not likely, but let's just say maybe that happens. Okay, now at that point, you could decline, but let's say for whatever reason you don't, which is fine, and you agree to it. All right, you're alone. You have coloring books, you have Lego, you have Disney Channel, whatever. You have all your fun things, and presumably you know the child well enough. Why would they ask you to marry? Why would they ask you to babysit the child otherwise? And okay, so you're playing those things. Then what are you worried about? Oh, well, I don't know. I hadn't really answered that question. Well, this is the moment of truth. What is it that you're worried you would do in that circumstance? And then often the client will say something like, well, I don't know. I can't imagine doing anything in that. I can't imagine, because I don't want to do. Okay. So when you have that truth, what if my friends have daughters? You can answer, just walk yourself through it. And also, okay, let's say you're in that situation. You have the urge. You still have the choice not to do it. You can still, one, just refrain. Two, call your friend and say, I'm sick or whatever, and come get your kid. Like, there's so many other answers to this scenario. Now, of course, if there was a real risk of this, you wouldn't want to end up babysitting the dog, but you get the point. So, going on here, I'm also afraid that if I'm not able to have relationships with women my own age, that I'll resort to pedophilia. So this is another part of pedophilia OCD that I often find is the case, is that the individual is not and has not really been in a satisfactory long-term relationship. It's not a major factor, but the people I hear worrying about pedophilia OCD are people that are just kind of flailing sexually or romantically. And they have all these urges inside, and they don't really have anywhere to put it, and they have all these worries, and they don't, because if you were in a satisfactory relationship with someone your own age, one of the ways you could check to see if you're a pedophile is to check to see if you're attracted to your partner, and you go, oh yeah, why would I? Now, that isn't to say that you can't have pedophilia OCD and not be in a long-term relationship, because you certainly can, but anyway, so I just thought I'd say that. But I'm also afraid that if I'm not able to have a relationship with women my own age, that's another OCD thing. Like, oh my God, what if I'm alone forever? That I'll resort to pedophilia, even though I've never wanted to have sex with children. What if I'm walking across the bridge and I jump off the bridge? What if I leave my house and I impulsively drive to a bridge, get out of the car, park the car, get out of the car, and jump off the. What if that happens? Okay, well, and I laugh. I'm laughing at myself, and sometimes it's good to laugh at that kind of stuff, even as a therapist. Be like, let's really look at what you're saying going on. Rationally, I know I'm not a pedophile because I used to tutor a boy in an after-school program. And at school, the little girls around were just kind of background noise, and I really did not pay attention to them at all. I had a blast watching my student grow and helped him with his academic struggles. I would kill to be able to do that again, completely anxiety-free. All right, so let's go through this. I don't know what the gender is. So they are saying, rationally, I know I'm not a pedophile. And it's funny, the evidence, right? most people, like myself, Kirk, I know that I'm not a pedophile. Why? Because I just know, because I'm not attracted to children. But for people with pedophilia OCD, that's not enough to just say that to them. I know that I'm not a pedophile because I'm not attracted. That's not enough. They need concrete, more concrete. It feels pretty concrete to me when I say I'm not a pedophile because I'm not attracted to children. But to them, there's enough uncertainty, and I think also for people with pedophilia OCD, it stands on a foundation of not having enough of a track record or enough satisfactory relationships sexually that they can kind of bank on. Like the thing that I can kind of bank on is just my sexual history that has been oriented in a fairly one-directional way, But if I was 14 and didn't really have much of a track record, maybe I wouldn't have as much of a foundation. So a lot of younger people, I find, teens and people in their 20s, are more prone to this sort of thing. But anyway, so this individual is looking for evidence, and the thing that they point to is, well, I used to work in this after-school program, and I was tutoring this boy, but there were a lot of girls around, and I never looked at them. They just were background noise to me. They were just girls at school, just kids at school, and I never was attracted to them. I never looked at them. I never had any of these thoughts. I never had any of these worries. So rationally, I know I'm not a pedophile. So you know what I mean? Like, this is the kind of mental activity that people with OCD will do, is that they're so desperate for something to hang their hopes on that they'll kind of look to these things, but they don't really have a lot of validity to them, right? Because you could still be a pedophile and having tutored a young boy at school and not have noticed being attracted to the girls at school. You might have been in denial. You just might not have been in a sexual mood, or there's a lot of other things. And that's another part of OCD, is that it focuses on things that are less easy to confirm or not, right? Like with germs, it's unknown, right? You could have a lot of germs on your hands at any particular moment. You could have a parasite on your hands that could kill you. You could have an amoeba or not. You could have 10 different bacteria and viruses or not. Who knows? There could be, the virus could be in the air. It could not. You could die tomorrow. You might not. It's too ambiguous, right? So when it comes to people who have yet to have the track record and positive experiences, maybe they are a pedophile. And what if, I think another factor in the rising tide of this problem, I think all these people with pedophilia OCD probably would have had OCD anyway. And it just happens to manifest in pedophilia OCD because it was the first trigger that triggered their OCD. And so I think another factor is that it's good that there's a lot of awareness about sexual abuse, right? We have a lot more than we did 30 years ago, which is wonderful. It's a step in the right direction. We have a long way to go. But there's a side effect, which is that there's almost this overemphasis on pedophiles in general that anyway, I hope you get my point. So that's one example. I'll read one more. So this person says, I cannot live with this guilt, shame, and anxiety. I am an 18-year-old female. I have struggled with intrusive thoughts for 3 years that I could be a pedophile. I was sexually abused at age 5, so pedophiles have always been my worst fear. I have figured out that I am 100% in no way attracted to children. I'm certain of that now, but I've already done things that I can't forgive myself for. For example, so chiming in here, I'm reading this example because it's another angle to the pedophilia OCD that I will also hear about. So going on. For example, at age 15, I spoke to a person online sexually a little older than me who asked if I was attracted to kids. Okay, so just setting the stage. She's 15. This is a few years ago. And she was online talking to someone a little older than her. I don't know what that means. Is that 16? Is that 20? I don't know. I spoke to a person online who was a little older than me, and it was sexual. And that person asked me if I was attracted to kids. I said, no, I wasn't attracted to kids, but they said that they were attracted to kids. They had cut my name into them previously and had my full name and phone number. Okay, they had cut my name into them. So it's not like a self-tattoo or something. And they also had my full name and phone number. I was really scared of that person. They brought kids up during phone sex, and I played along. They brought up kids, so in the phone sex fantasy, talking about having sex with kids, and she's saying, I played along with that when I was 15. Afterwards, I said, I'm not attracted to kids in any way, and I just did all that stuff because I wanted to please them. And they said that they knew that I wasn't attracted to kids. I have felt immense guilt ever since, and I cut the person off shortly after. A little older, about 17 or 18, I got so sick of the intrusive thoughts and anxiety that I decided it'd be easiest to falsely accept that I was a monster, that I was a pedophile. So this is another element that I haven't talked about yet, I don't think, is that for people with this type of OCD, it's sometimes easy. It's almost like dealing with an abusive spouse, that sometimes it's just easier to take the path of least resistance to just say, okay, I guess I am a pedophile. Because if I just accept that I am, or convince myself that I am, then I won't have to constantly check, and I won't have to beat myself. I'll just say I'm a piece of shit. I'm a monster. So this is what this person is saying. She's saying, after a couple years of this constant shame and worry, what if I am attracted to kids? I did participate in that. And okay, I also want to point out that it's quite possible that it's viable to describe what this person went through as having been victimized, right? She's saying, I'm online, and someone who's a little older than me, let's say the person is 20 years old. And from the sound of it, this older person knew that she was not attracted to kids and forced her to talk about kids. And of course, the fact that this other person is older and might see her as a kid as well, and is forcing her to engage in this for various different reasons. She engages in it. The other person knows she doesn't want to do it and is turned on by the fact that she doesn't want to. Is turned on by the fact that it involves pedophilia. It's turned on by the fact that the person knows that she doesn't want to do it. And she knows that he knows, and she knows that, I'm saying he, but she knows that the other person is exploiting her, and has more power. There's coercion there, right? She didn't want to do the participation. Sometimes in sex you do things that you wouldn't do otherwise, and it's not necessarily rape, right? It's just like, yeah, I'm not really into dirty talk, but they were, and so I did, So it could be something like that, but it also absolutely could be that this person is victimized, and it wouldn't be unusual for anyone to have gone through sexual trauma and not realize that it was, they don't call it sexual trauma. It's particularly true for young people. She's saying she's 18 right now. It's common to have that awareness emerge over time. I'm not saying that she was abused. I can't tell, but so it's and it's very common for people having gone through these traumatic experiences to blame themselves. I must have wanted it. And so if she was traumatized, coerced, raped over the phone, if you will, and she's having traumatic effects afterwards, one of which being shame and terror and something's wrong with me, I must have wanted it. And that wouldn't be unusual, right? And so this is another manifestation of pedophilia OCD, is that it can be a result of trauma like this, right? Not always, but it can be. Anyway, so she's saying a little older, around 17 or 18, I got so sick of intrusive thoughts and anxiety that I'm a pedophile and a monster, that I decided it'd just be easier to falsely accept that I was a monster. This led to me pleasuring myself to certain situations in my head to test myself and to see if I really was a monster, pedophile, or not. Again, chiming in, you hear the hallmark, right? That checking. Am I a pedophile? What if I force myself? Would I be turned on? Okay, going on. I feel so guilty. I can't carry this around for the rest of my life. Even though I know it was my mind lying to myself, I still acted on thoughts, and even though, and even the thought of a real child at one point, and I even thought about a real child at one point to see how deep I was into it. I read that sentence funny because I'm mildly dyslexic. I can't carry this around for the rest of my life, even though I know it was my mind lying to myself, meaning that I'm not really a pedophile. I still acted on those thoughts, and I even thought of a real child at one point to see how deep I was into it, to see how deeply pedophilic I was. Although I'm definitely not interested in kids, and I've cleared my mind of that aspect, how am I supposed to carry on knowing that about myself? I've been feeling extremely suicidal over this because no matter what, I can't go back and fix what I did. I feel disgusting. I feel like a monster. Okay, just chiming in. I hope that you listening would be compelled to tell her there's nothing wrong. You didn't do anything wrong. I mean, at worst, I guess you participated in a fantasy thing that you didn't want to do. Or, in terms of, right, I hope you get my meaning. But it sounds like you were coerced and harmed and were forced to do something that you didn't want to do. And you're horrified by it, which is fine, but you're blaming yourself and not the person that coerced you to do it, which is a very common thing that people will do, particularly girls, right? Anyway, going on. I just needed to get this off my chest. I didn't even know what pedophilia OCD was until sometime this year, and it reassured me because I really made myself believe I could just be a pedophile. I think I would rather commit suicide than live with the shame of what I did. End of post. Yeah, so I hope you hear a different angle in this one, right? It's more. It has a lot of angles to it, right? Is it really pedophilia OCD? Because I'm not hearing it's possible that the quote-unquote intrusive thought would be conceptualized not as OCD, but as a trauma response, if that makes sense. It's hard to describe, but I hope you get the idea that there are a lot of different kind of manifestations of this. So let's read one more. This is also from Reddit. Please help me. I just want to know if I'm a complete monster. So here's some background. I'm a 15-year-old female. This is the only kind of OCD I've had to date, and it's fairly new. Okay, so that's notable. But being 15, there's not a lot of time for various aspects or various different faces of OCD to show itself. So ever since I've developed sexual desire, I've always been aroused by things that were considered taboo, like rape fantasies, incest, etc. The extreme factor of them is what really gets me off. However, I wouldn't actually do a majority of these things in real life. For example, I wouldn't want to be in an incest relationship. With that being said, I definitely have pedophilia OCD because I have all the symptoms of it. The compulsions, the intrusive thoughts, the intense anxiety, feelings of false attraction towards young girls, but I'm wondering if the attraction is actually real. Can you have pedophilia OCD and actually just be a pedophile at the same time? Because I know that pedophilia OCD's job is basically to convince you that you are attracted to children. But honestly, it feels so incredibly real that I'm not sure if it's just pedophilia OCD anymore. I hope I'm wrong. Now, back to my taboo thoughts. I'm just going to be completely transparent here, even though this is really hard to write. The reason why I'm thinking it might not just be OCD is because before all of this even started, occasionally while I was masturbating, I would think about men having sex with little girls. Not often, maybe a couple times. And I would get off to these thoughts. I was pretty sure that it was just the tabooness of the thoughts that would get me off. And I would never think of myself actually doing sexual acts with children. I think that the thought of such an evil person doing an act that was so widely despised in secret is what aroused me. For some reason, I never thought anything weird of these thoughts until about a month ago, which is when the pedophilia OCD started. I just want to clarify, I have never been sexually attracted to an actual child in my everyday life. I've never had a crush on a child. I've never had an issue interacting with children before, and I've never had the urge to do anything sexual with a child. The thought that I was a pedophile never even occurred to me before this pedophilia OCD thing started. Okay, just chiming in here. So what we're hearing from her is that she's very self-aware, that she has all the hallmarks. She seems pretty educated on pedophilia OCD. You know, she says, I have the intrusive thoughts, the compulsions, the anxiety, the feelings of false attraction towards young girls. But then she says, I have fantasies that are in the taboo region. And one of the taboo thoughts that I have found to be a turn on is thinking about a man having sex with a little girl. And she says, maybe a couple, she says, not often, maybe a couple times that I've gotten off to those thoughts. And she says, I'm pretty sure that it's just the taboo nature of this thought and not the actual thing itself, which, is, so in this scenario, it's hard to tell, right? She's 15. Who knows how her sexuality will develop? Is it possible that she is just discovering an aspect of her sexuality and that pedophilia is present? It is possible, but it doesn't. I wouldn't put a lot of money on that bet. But it is possible. But the hallmarks is that she is saying to herself, I'm pretty sure that I know myself enough to know that I just like taboo things. And that's a lot different than wanting to actually do it in real life. And that's a well understood phenomenon when it comes to rape fantasies. A large percentage, something like 50% of people, women included, will have occasional rape fantasies. And there's a smaller percentage that have it frequently, but it's some pretty sizable minority of people that have frequent rape fantasies. Like, I don't know, 5-10% or something. Don't quote me on that. I've seen the research before, but it's something like that. And you ask these people a second question, which is, do you want to be raped or do you want to rape? And they will say, absolutely not. Now, a percentage do want to do these things, but it's very, very small compared to the percentage of people that are engaging in this that would never want to do this and would be horrified. So what is that? How can you have a fantasy and be turned on by something, but in real life have the normal horrification, if you will, of the event? Sexuality is weird is the answer to that. And there is a well understood element of our sexuality, not for everyone, for many people, that is entertained by fantasy, that has elements of, like, and she's pretty aware here. She's like, I'm pretty sure it's just taboo. Like I like the idea of someone that would do something behind closed. She isn't saying this specifically, but she's like, they're doing something dirty. They're doing something wrong. They're doing something that is despised by people. And there's something about that kind of turns me on. There's various different flavors to this, but a lot of sexual turn-ons have to do with this kind of thing. And I could get into specifics around like how some of these fetishes can become sort of mainstream. I mean, the fact that we call people baby, oh, baby, like, I don't, that feels like a manifestation of this, right? That, of course, we don't want to have sex with babies, but the role that a baby plays, right? The submissiveness or the cuteness or I don't know. I don't say baby myself, so I can't really tell you, but but it has, it has something to do with that. And so we understand that. And you could also have a taboo fantasy that involves this kind of thing, but never, ever, ever want to do it in real life, in the same way that you can have a rape fantasy and never want to be raped or never want to rape. So going on here. But because she had some of these thoughts, she's ruminating on it. And I think this poster on Reddit is saying, I have this tendency to go into pedophilia OCD, to ruminate and to fixate, but I have enough knowledge and maybe enough mental health capacity to push back on it. That's kind of what I'm hearing going on. Now, my pedophilia OCD is convincing me that I'm just a pedophile for real, and it's literally killing me, and I feel like I deserve to die. I have a boyfriend, and I have told him about these thoughts and my pedophilia OCD and everything else, and he was fine with it, thank God. But if I'm actually a pedophile, then I got to break up with him because he doesn't deserve someone like me. I do plan to see a therapist about this. Okay, end of post. So the way that this looks is it looks like this person is suffering from pedophilia OCD, but they also know enough, perhaps even because they've posted a lot on the subreddit or something, that they have been reassured that they're not an actual pedophile. But they're having a particular difficult moment in that day, and they're making the post perhaps as a check, right? Of, I'm pretty sure I'm not, but I'm just looking for reassurance. I can relate to this in my health anxiety that I have mostly conquered, but in the past, there were times when I would have just tremendous, like I would have some sensation in my chest or something. And I would, in my conscious mind, I would be like, everything's fine. The likelihood of something bad happening, given all the blood work you had last week or whatever, and the reassurance you had that your heart is strong or whatever, the chances are extremely low. And also, if there is the off chance that you are on the verge of dying, people die. And so, don't give up on life, but also like you don't have control over that sort of thing. Anyway, that was my thought process. And so my conscious mind is like, there's nothing to worry about here. At the very least, there's no usefulness to worrying. And in all likelihood, the worrying is causing the problem. It's causing the chest pain or whatever from the stress. I knew that. I'm a therapist. I know this. I treat people, but my body was another thing. My body was, and the intrusive thoughts and the rumination and the fixation and the adrenaline, I don't have control over that. So it is taking over. And so what I would do is I would look for reassurances, even though I basically knew that my body was overreacting. And so I might call the 24-hour hotline nurse that my health insurance offered or something, or I might talk with a friend who knows a little bit about medicine or something, or I might even go to the physician. I might make an appointment or something, So not to say that those are bad things, and it's complicated, but it all just depends on whether or not you're perpetuating the problem, or going along with the problem, or if this is a part of your recovery. But for this individual that is posting on Reddit, it kind of has that feel to it, and they even say at the end, it's like, yeah, I'm going to go to therapy at some point. But I guess I'm just looking for some reassurance because, in her post, she's both very clear that she's not a pedophile, but also very clear that she is a pedophile, or she has this major question, right? And I'm guessing she knew that most people would respond and say, you're not a pedophile, everything's fine. But she needed that, and that's fine, and is fine in the interim. It's better to do that than to do nothing in a lot of ways, until you can get to a specialist therapist that can help you recover. Eventually, you want to be in a place where you don't act on these checkings, because by checking, you're just engaging in that cycle between obsession and compulsion and relief and itch and relief and itch and relief. That just gets worse. It spirals out of control, So that's what I'll say about that. All right. Again, with this presentation, it's different. Every presentation is a little different. And some are a little bit more ambiguous. Some you're thinking, well, I don't know what's going on there. But with others, it's more clear. Anyway. So, all right, y'all. Well, let me know what you think. And check in with yourself, because, this is a heavy topic in a lot of ways, not only just with anxiety, but also with pedophilia and sexuality, fantasy, I suppose. So, check in with yourself and take care of yourself, because you deserve to take care of yourself. You deserve to check in with yourself. You deserve to get the therapy that you deserve. You deserve to have people around you love you and take care of you. You really, honestly, you really, really do.